In response to injury of the blood vessel wall, the body relies on a dynamic coagulation system to stop bleeding. At the site of injury, clot formation is initiated by the adhesion of platelets, followed by activation of the coagulation cascade. Clotting factors bind to the surface of platelets, leading to thrombin production, which enhances activation and aggregation of platelets. Thrombin also causes fibrin strand formation, which reinforce and stabilize the developing clot. Clot formation at the site of injury helps stop the bleeding. As part of the normal healing process, the clot is gradually degraded from the wound area. Patients suffering from hemophilia lack either clotting factor 8, hemophilia A, or clotting factor 9, hemophilia B, and the normal blood clotting process is impaired. Thrombin generation is slow and in insufficient amounts, which affects clot formation and the ability to stop bleeding. If thrombin production is severely deficient, the patient is at risk for bleeding even without injury. A hallmark morbidity of hemophilia is bleeding in the joints, which can lead to arthritis, degenerative changes, and other complications. Bleeding can be life-threatening if it occurs in the central nervous system, gastrointestinal system, or if it's associated with significant trauma. Hemophilia is a manageable disorder, and bleeds can be stopped with therapy. To prevent long-term complications, prophylactic hemophilia treatment should be initiated at an early age. The clotting system maintains a balance between preventing excess bleeding and avoiding thrombosis. To accomplish equilibrium, the coagulation cascade balances cofactors, receptors, and inhibitors. When the endothelial wall is injured, the tissue factor pathway is activated by tissue factor TF exposure and the binding of activated factor 7, while the tissue factor activated factor 7 complex is capable of activating factor 10 and subsequent thrombin production. This can be blocked by the inhibitory tissue factor pathway inhibitor, TFPI, which is present in platelets, plasma, and the endothelium. The coagulation system counters the effect of TFPI via an amplification loop. This rapidly activates factor 10 and produces thrombin. In hemophilia, this amplification loop is inadequate due to the deficient factor 8 or 9 and the inhibitory effects of TFPI. This renders patients at risk of bleeds. In addition to inhibiting the amplification loop, TFPI also inhibits the propagation phase of clotting by binding to factor 5 and thereby prohibiting conversion of prothrombin to thrombin by the 5A-10A complex. Reduction of TFPI activity is being studied as an approach to counterbalance the risk of bleeding while avoiding an increase in thrombosis events. There are various approaches to modulating TFPI activity, including antibodies directed against this protein. Development of therapies that may not require replacement of clotting factors might allow for new approaches to prophylaxis while avoiding IV infusion and frequent administration. At Pfizer, we have demonstrated our commitment to developing therapies for hemophilia for 20 years. We continue to pioneer new approaches to treatment by conducting research and partnering with the hemophilia community. For additional information, please visit www.pfizer.com/health-wellness/disease-conditions/rare-diseases/hemophilia.